It's an interesting crossover, head injuries and into mental health, but they are linked in the long tail of recovery. So that's why we thought it was important to bring to the table today. So now our last speaker before we hear about the tools and resources that the system has to offer is Terri Symanski, who's been a pioneer with the OPSEU union in working with John on the mental injury toolkit and in administering the survey and doing lots of other support to workplaces in workplace mental health.
Great. Well, hi. Thanks for inviting me today. I brought my trusty clock, but you'll give me a 5-minute warning, won't you? Yeah, great. So yeah, it's been about 10 years now. John told you that the mental injury tool group started having, workplace stress and psychosocial hazards on our radar about 10 years ago. And then we saw Martin Shane's report come out that talked about just figure out how to move this ahead here. The Perfect Legal Storm, where he talked about 7 areas of law that was basically carving out some kind of a role for employers to prevent and address psychosocial issues. Around that time, I guess the Federal Minister of Labour had a meeting, which one of our MIT committee members, Symanski Saarinen, attended, where they said that $51 billion was being the cost of this on Canadians. And so then the standard started to be developed. But along the way, the Mental Injury Tool Group released some tools, and John gave you a list of those, so I won't go into them. In the work and the learning journey that we were on, we were learning organically through doing in the workplaces and trying to address psychosocial health and safety issues, and identifying, assessing, and controlling them like health and safety. We didn't really realize it, but the model that we were approaching the issue with was actually written about in a systematic review by Marc Corbière back in 2009. And we were discovering this model and approach ourselves through our organic work. And so that started with, whatever you think the issue is going to depend on, that's going to dictate what you do about it. Well, interventions and supports need to help the person, as well as efforts to change any organizational factors or adjust the way that the organization addresses issues. So for us, it was kind of a twin approach. We were kind of thinking, both of these aspects of change have to be considered. And 2 of our MIT committee members sat as 2 of the 3 labor reps up on the standard development committee. So we were able to be feeding our knowledge that we were gaining up there to that table. So, for instance, an intervention for an individual to make the change would be like managing stress or building the resilience, etc. Whereas, an organization might modify tasks or schedules, to be the twin activities to address the same things from both aspects. In essence, the visual picture that I have in my head is it's not just the person we want to build themselves and improve themselves and change we also want the organization to look at how it does this stuff and whether there's changes that can be there. So in essence, the organization's on the treadmill as well. And then when you bring the occupational health and safety hierarchy of controls to it, we then break it down to primary prevention at the source, getting rid of the source if you can, eliminating it, addressing it. Secondary, where you can't eliminate the source of the problem, you can, protect it, put a barrier between it, try to buffer the effects of it for the worker. And tertiary, obviously, after there's harm, what support you can bring. So this is the kind of view that we kind of approach this at in our workplace projects. And altogether, John might have showed you this, what we call it an intervention in every quadrant. In other words, a full, comprehensive kind of approach to this issue includes interventions to help the individual and to build the individual at a primary level, like building coping and resilience skills. Secondary level, on the treadmill, quitting smoking, doing yoga, having wellness programs to make the person, healthier, and also getting therapy and medication and counseling if they need it. Likewise, on the organizational side, if you have the organization on the treadmill, They're looking at what organizational factors can I adjust to make things easier for people at the primary level. Secondary level, what kind of awareness training and programs and stigma reduction programs can I come to that buffer the effects on people and make my organization a softer place to fall. And likewise, tertiary, what can I provide people after something happens? The standard came, and it has an approach, and I took these quotes from they studied 40 companies for a couple of years after the 40 companies that adopted the standard, and I just want to tell you that our approach is kind of, there is good things happening. From the 40 company study, some quotes from some people that participated in that. Ed Kane, for instance, said, I want my policies and procedures to cover the work. I don't want my workers to go the extra mile. So he said that at his organization, he reviews every policy now with a new lens about how it's going to affect people. So this is from the 40 companies. And I'm using the 40 companies examples to show what kinds of activities are happening out there and what their challenges were the exact reason why it's important to take the comprehensive approach that I've explained. So for instance, right from the 40 company research book, from the research, the top actions of the 40 companies from the study, right out of the book, is that respectful violence and education policies, EAP, enhancing knowledge about mental health, building worker resilience, supporting staying at work once somebody returns to work, training managers in mental health. So when I plotted those on our model, there's a lot of activities in different quadrants. I'm going to add another, because lots of companies have wellness programs already, so the wellness programs kind of exist. So when you I plotted on there what the top activities of the organizations were, and then I wanted to point out that reinforces our MIT work on how do you deal with the organizational factors at a primary level. And when you look at the top barriers that the 40 organizations faced, the yellow ones I'm going to focus on, because the other ones are about some kind of measuring or data. So, 1 is limited access to data, 5 is data collection, 4 is, lack of evidence of employee knowledge. So let's just look at these 3. So when you take out all the data ones, because that tells you data is very important, but really, addressing psychosocial health and safety in the workplace is what are the issues and addressing the issues. So these are the main 3 challenges that they said in the 40 company study. Inconsistent leadership support, significant organizational change, because it's hard, obviously, and inadequate resources. So I would pitch to you that those 3 big challenges, combined with the whole need for the shortage of data, that's an issue, and that's why we really need to, as the MIT committee and everybody, start thinking about, what do we think about this comprehensive approach model, and would we like to have interventions in every category? Because so that's how we've been going out there working with our workplaces. So OPSEU is working with a bunch of workplaces in our union. We go at it with a cooperative approach. There's some locals who have toxic workplaces or whatever, and are taking, a different approach using the data, to try to make change through grievance procedures and stuff. But we have provincial OSI committees in Ministry of Corrections, Youth and Adult, where we talk about these issues from a proactive status. And also, what we do is encourage workers to print off a blank copy of this and plot what their organization is already doing, and then take that to the Joint Health and Safety Committee with the stars on it, like I showed you already. So you can go to an organization and say, look what you have already. Can we work on this top right-handed area of organizational change? So that's been working. That's a tip that's been helping. What we really do is we say to workplaces, you have to have someone to lead this, to champion this. Then you have to go and get everybody else in the workplace involved, the joint committee, the leaders. If there's a leader that's a champion, go and speak to that person. Get something going, form a committee together. Oftentimes we have to turn anecdotes into evidence by doing some kind of a survey. So I won't go. John had this slide and talked to you about, stress assess and the process we go through there. So if we have to it's identify, assess, and control. So if the workplace wants data, we can use Stress Assess to go and turn anecdotes into data. But sometimes they have ears and they listen and they make changes just when the workers bring up the issues as Health and Safety Committee recommendations. So that's how what we try to do. At our provincial OSI committees, we make recommendations and the employer undertakes initiatives. So they're currently looking at peer support training, developing in the correction sector, and they've also already done some resilience training. So what we're doing is looking for something in every category. So we're working jointly with a bunch of employers at CAMH. CAMH has a big organization, and we're talking about doing Stress Assess on the off year that they do their engagement survey. It's not final yet. We were first trying to think, we wanted one big survey, the unions and the employer, to underpin their psychological health and safety plan, because they're doing a lot there. And we found it's not so easy to merge things, so we're thinking of doing Stress Assess on the off year as a total organization, the unions and the employer together, because they think their engagement survey catches a lot, but there's things that it doesn't ask. It's about engagement, but there's other things in the COPSOC 3 that John went through that really are burning issues for workers. And if you don't deal with the burning issues, then your plan, no matter how much resources and that you're putting to it, isn't going to be as successful. So that's why, and we've been working with one of our first workplaces, I've probably said this in presentations before, a Victoria Order of Nurses who, after the workers, through a crisis approach, because it was already beyond, like, it was far gone, the workplace, brought the approach, the employer and the union rolled up their sleeves together and negotiated a new way of dispatching calls from a citywide model to a geographic model, which dropped the workload, lessened the bullying and harassment, and lessened the emotional demands on the workers. So we've had some success with some organizations who are willing to tread into that. What in my organization can we adjust that affects people differently? You know, notice for time off, these kinds of things can be very helpful. So basically it's about a process of, if you have to turn anecdotes into evidence, you can use a survey. But we also look at addressing concerns. Like, for instance, that VON employer has never heard of the standard, but they've implemented it as far as I'm concerned, because what they did was they took a bunch of concerns that their workers were bringing forward and said, we'll have to change the way we dispatch the calls to deal with this, because we still need to service the same number of patients. So now instead of you driving an hour to get to them, you'll just drive 10 minutes. That's how we're going to drop the workload. They did it. And I mean, this is not a research finding, but a year later, when I phoned up my local president, she said, the air is different here. So I didn't go out and measure it, but to me, I'll take it. And they never heard of the standard. So what adopting the standard really is identifying, assessing, and controlling the issues that are going on in the workplace, and not just the issues in the win-win area, but also some issues outside the win-win area. The win-win area is the area of common interest between workers and employer objectives, but maybe the 4-hour shifts aren't in that common area, but it's a burning issue for workers. Or, temp contract after temp contract and never knowing how many hours you're going to get is a huge stress for workers. So to try to create a psychological health and safety plan without turning our mind to those areas outside the win-win that are burning for workers is an issue. And that's why CAMH said, hey, why don't we do that one in the off year? Because we want to capture those ideas and issues. And so after the results, we create a one-pager that summarizes the results, because not everybody wants to look at a 20-page thing of charts. No one except John, that is. But so we create a one-pager, and we can do it pretty quick. My locals can do it pretty quick, 10-15 minutes on the phone with me going through the report. And one day, Stress Assess maybe can extend to help with the after the survey process. Then we hold meetings, brainstorm issues. The people in the workplace know the issue, they know their work and they know the solutions. We write down specific solutions, and I'm not talking about better communication. The specific suggestion that then gets turned into a health and safety committee recommendation, if necessary, or if the employer's there, we're all participating. It doesn't even need to be a recommendation. The employer can just implement the ideas. But we brainstorm meetings in person, and not everybody feels comfortable saying their specific ideas. So we usually open an email confidential period to send in their specific suggestions. And then we theme the content and create a tabling document and work plan. So if it's a joint steering committee, the joint steering committee does that together. So the themes might be justice and respect, one of the topics on the COPSOC, or offensive behaviors, or communication and transparency. So based on the survey results and the suggestions that everybody sends in, we theme what the biggest issues are. We might have 3 or 4 themes, and then we have specific suggestions under each theme. And we have samples. So what we do is we help and walk workplaces through the one-pager, through planning the meetings, through collecting the brainstorming, through collecting specific suggestions and helping them theme their document, their work plan, which they move forward with. And when you do this in a workplace, your culture will change without actually going out and going, how am I going to change my culture? I kind of see culture as an output of inputs. When the other day, or I guess last week, I was with Tracy at ETFO, and Dr. Martin Shane was there, and he was talking about how difficult it was to use the culture tool to change culture. And we had a really good discussion after, when I said, Martin, what do you think about culture as an output? And that's why, we can't go in and say, here's a recipe to change your culture. Because in that VON that changed the way that they did the work to that kind of model, and the air being different a year later, that was culture. That was the culture change. But it came about as a result of inputs. So, it might seem obvious, but so for us, what we do for the MIT committee and what we do out there in workplaces and what we have going, I guess about 10 or 12 workplaces at any given one time, just in the OPSEU membership, working on this at various stages. We identify the issues, brainstorm the ideas, implement the organizational change, or other changes, because at the OSI Committee in Corrections, we're in other areas of the quadrant, with the resilience. So we aim to work on all areas of the quadrant, whatever ones. And there's often this term low-hanging fruit. Like, there's nothing wrong with low-hanging fruit as long as you move to the high-hanging fruit later. So, because a lot of places will start with the low-hanging fruit, but in the chart, the low-hanging fruit is often just trying to change the worker, or putting more wellness, or giving them more supports. That seems to be the low-hanging fruit, but in the VON place, changing the way they dispatch calls was a little harder. But that made the biggest difference. So I guess when I figured that I would use this as my last slide, I was thinking, your culture will change from the inputs that you put in, and dealing with the systematic kind of approach with the 6 quadrants is helpful, because it kind of prompts us where there might be gaps and where we might need to do work. And so with that, the mental injury tool group just met. We're kind of like a community of practice that just keeps continuing on. But we want to update the mental injury tools, and we're in the process of translating. And we want to develop a mini-MIT, because we've got to turn 100 pages into something smaller. It's an online kit. We wanted it to be online because we click to all the different resources in the world. And of course, my personal hope, and I think the MIT committee shared it, is that instead of helping workplaces one by one through the after process, that eventually that we make that part of the process on the mental injury tools. See, and I was even probably quicker than 20 minutes.
We got 5 minutes still.
That's great. Well, that's more time for questions then.
You staying for lunch today?
Yeah, I'll stay. Yep. So,
People have any more?
I'd like to have more examples of organizations rushing out there to make organizational change. But I would say that when you saw the challenges there, that's the exact reason why we need to keep pursuing that's part of the high-hanging fruit that people get to. Because, you know, we can't really stop at the other ones, because then you're not really doing the best that can be done on the issue, and you're probably not getting the best return on the resources that you're spending on the other things without dealing with the burning issues. So that's the message I always bring. And because I'm never sure who has attended, because we've been talking about this tic-tac-toe table, we nickname it, for 10 years. But I don't ever know who has not seen it before, so I always have to kind of go through it here, because this is doing this in a health and safety framework, taking the hierarchy of controls that we use for health and safety to this issue, and realizing that you can do a hierarchy of controls to deal with psychosocial hazards in the workplace. And I mean, the MIC committee has been saying from the very beginning that this, you know, we have a chart of, you know, physical, chemical, safety hazards. Psychosocial has always been in that list. But then, you know, just the evolution. I'd say in 2009, workers were phoning me saying, my employer is saying this is not a joint health and safety committee issue. So we've moved from this is not a joint committee issue that we used to hear to I already have an engagement survey. And so now we have to bring people beyond that to say that the engagement survey measures engagement, but there's other stuff that turn these issues. Okay, great.